All right, hey guys, good afternoon. I think I know most of you, but it's Joel Ham, faculty with emergency medicine and work in the Global Health Initiative office. So we'll start off today by acknowledging today is actually Native American Day, which is kind of cool with our topic. So we just celebrate the indigenous peoples that have been in the United States, and part of that, we want to just acknowledge the tribes that were here actually on this land before the immigrants came. So some of the tribes were Osage, Cherokee, Shawnee, Adena, and Hopewell. So those were some of our local First Peoples. So we'd like to invite you to the keynote address, so that's what we're doing today for the case competition. And as you guys know from the case competition, you've been working on it all week now, and so we're really excited about what you guys are going to present. So this is a topic. So this is Global Legacy of Environmental Injustice to Indigenous Peoples in the Wake of Weapons Development, Industry, and Technology. And I'm actually going to read the biography of our guest speaker today, Dr. Johnnye Lewis. So Dr. Johnnye Lewis is the founder of Community Environmental Health Program, CEHP, at the University of New Mexico's Health Science Center College of Pharmacy. She serves as the director for this organization from 1996 to 2022, and currently co-directs the CEHP with Dr. Deborah McKenzie. Dr. Lewis holds an MA in psychology from the University of Victoria, a PhD in pharmacology, University of Manitoba, and she did her postdoctoral work in inhalation toxicology at the DOE Inhalation Toxicology Research Institute. After running her own environmental health consulting business looking primarily at the impacts of Cold War weapons waste on indigenous lands and communities, she went to the University of New Mexico in 1996 and began building community research partnerships to address environmental injustice concerns through team science that integrates population and field studies with mechanistic laboratory studies to link exposure to outcomes, confirm mechanisms, and develop environmental and health interventions to reduce risk. Her most recent work has focused on community-driven studies of multi-generational impacts of exposures to abandoned mine waste resulting from Cold War weapons development, examining the mobility and toxicity of these mixtures within the context of current land use practices. As Professor Emerita, she continues as director of the University of New Mexico's Metals Superfund Center, NIEHS funded, and as MPI of the Navajo Birth Control ECHO Study, NIH funded, and the Center for Native American Environmental Health Research Equity, NIMHD funded. She is also partnering to pair indigenous artists with scientists to improve research translation, expand research perspective, and most recently to envision new strategies for long-term management and disposal of the massive volumes of Cold War waste on indigenous lands. Wow, that's a lot. So Dr. Lewis, come on up. Let's Thank you so much.
And before we have any political ramifications, it's a birth cohort, not birth control. So just want to make sure that that comes through right. Okay, well, it's really a pleasure to be here today and to have an opportunity to really expand on the fact that these issues really are global issues, and I'm really excited to see the cases tomorrow. I think I'm going to try and use this as a pointer because it'll show up on all three screens. So the work that I'm going to talk about today is primarily going to be from a number of centers, as Joel explained, that have been looking at these issues now for decades and allow us to actually now look across generations as well. I don't have any conflicts of interest to disclose, but I do want to acknowledge that all of the work that we do is in partnership with the communities that are listed here and the tribal research review boards, committees, or councils as appropriate for each of the tribes has oversight and monitors the work that we do as well. And then, of course, this is all team science, and they're large teams, and we have many partners from across the country that are also involved. So I'm going to start by giving just a little bit of a background on what Indigenous tribes in the U.S. look like in terms of some numbers on that. This is something maybe that you've already come across in some of the work you've been doing for the cases. But there are about 7 million Indigenous peoples by the 2020 census numbers, which actually doubled the count in the U.S. We've always known it was an undercount. We still think it's an undercount, but at least the last one was a little bit better. This compares to about 10 million who were here pre-contact, 90% of whom were lost by 1700. So we still have a long way to go to get back to where we were at the time of contact. There are 15 states with over 100,000 Indigenous population, and by state those numbers vary pretty broadly. The blue states here have the highest concentration, and the 15 western states actually have about 50% of the Indigenous population in the country. The tribes have, the federally recognized tribes at least, have treaty rights that were entered into with the U.S. government that were the basis for establishing borders and the rights between parties that are to sort of codify how those interactions are to occur. Those treaties have been historically very poorly adhered to, leading to the topic we're talking about today, where treaty lands were given away to resource extraction as soon as resources of interest were found on tribal lands. Sovereign nations within U.S. borders today still have the right to self-governance, which existed prior to colonization and contact and is acknowledged in those treaties. That sovereignty extends also to data sovereignty and confers rights of privacy for individuals and the tribe. And that now has also, abuses of those rights have led to a lot of tribes now developing their own research policies, maintaining their own IRBs. And so any research that happens on tribal lands has to comply not only with university oversight and possibly IHS, but also with the tribal process as well. Whoops, sorry. And I just want to make a point that tribes are not a unified entity, but a group of sovereign nations, each with their own cultures, their own beliefs, and their own practices. There are, however, within those certain common themes that come out that may support resilience, making our understanding of these toxicity relationships even more complex. There generally tends to be very strong cultural ties and language roots, a strong connection to the land, and a very holistic view of the relationship to the land and the environment, and also strong familial and emotional support, which we'll come to at the end of the talk. So I want to shift gears a little bit here and talk about the history of mining and weapons development on Indigenous lands. A lot of which happened in association with the development of the atomic bomb and the subsequent Cold War development. The U.S., if you look at the map on the left here, what we have is a map of the 15 western states that have more than half of the Indigenous population. The hash marks are tribal lands, and the red circles indicate the areas that we're actively working with communities in. The pink shading is a density gradient showing the number of mines in that particular region. The Government Accounting Office has estimated 160,000 abandoned hard rock mines in these western states. And these sort of weird little pink blobs here are abandoned gold mines, and gold was the most predominant metal, but uranium and vanadium are right behind. US EPA has estimated that the waste from these mines, which is still there today, covers, has contaminated about 40% of the surface waters in the western U.S., and this becomes a serious problem in indigenous communities where there's a much heavier reliance on the use of local resources, much more of a land-based economy and lifestyle. In addition, we have limited data on toxicity in general because of the absence of these communities in research for a number of reasons that I'm not going to go into as part of the talk. But if we look now, these are the abandoned uranium mines, and the estimates vary pretty widely. US EPA estimates there are 4,500 of them. DOE's estimate is closer to 10,000 of them. We, on the basis of the 2010 census, which showed just a half of what we have now on the 2020 census, we estimated 600,000 people, 600,000 indigenous peoples live within 10 kilometers of this abandoned mine waste. And if you look at these histograms on the left, they show the ore that was the primary basis for the mines. And you can see that uranium vanadium mines were the second highest prevalence, just behind gold. And these are then the distances from tribal lands. So 10 kilometers may seem like a really long distance, and gee, do we really have to worry about that? So I thought I would show just a couple of images to give you a perception of what that looks like. So if we look on some of the mines on Navajo, this is the waste from the largest operational uranium mine in the country. This was an underground mine that was under this mesa. This is the waste from it, and it is very proximal to this community. And we're watching as the son of one of our grandson of one of our staff who lived in this home watches EPA move 18 inches of soil off that's contaminated, and this is where he and his friends have played and where 4 generations were raised in the shadow of this waste. When we first went into the valley, kids were using this arroyo that drained out the mine water during the operational phase, and they were using it basically as a sandbox. It's really nice, soft sand to play in. If we look at Crow, where we also work, or Apsaluke, the mines were up in the Pryor Mountains, and they drained into the basins of the Bighorn and the Little Bighorn River. And 30 miles away from that, where domestic wells line the valley that the homes are primarily located in, those wells are also in contact with the surface water that's contaminated by uranium, and we're seeing domestic wells that are contaminated as well. If we move up to the Cheyenne River Sioux tribe, 150 miles upriver was the Homestake gold mine in the Black Hills, and we can still see this band of oxidized arsenic along the cut bank of the river, and this can be as thick as 20 feet as you go across the southern boundary of the tribe. So that's 150 miles away. And during the operational phase of the mine, when the Cheyenne River was higher, the flood stages would push that material back miles onto tribal lands. So a few years ago, we got asked to be advisors for the Museum of Contemporary Native Art in a show that they were curating to look at exposure relative to Cold War weapons development across the globe. And what came out of that was an amazing understanding of just how global these impacts on indigenous peoples in the world were. And if you look at the paintings that went into that exhibit, it's not only from the US and Canada, which we think about a lot, but also from Greenland and the Bikini Atoll. These are abandoned waste piles that are on Navajo Nation. This is a site on the Marshall Islands that looks very similar. If we look at the common themes, we can also see that we've got exhibits from Australia and Japan. And one of the things that people commented on in looking at this was that it was amazing that these artists all came from different cultures and from different environments, and yet there was a very strong unity in the experience in dealing with these issues and the conviction to the damage that it had done to the cultures. We also work with groups in South Africa, and in South Africa, piles like this surround the city of Johannesburg, and for the city to expand, it's now being limited by the uranium waste. And uranium was found in the deep gold mines, 2,500, 3,500 feet underground. And when that co-localization with uranium was discovered, a lot of the mines just pulled it up with the gold. So it was never permitted. People didn't know when they were mining that they were exposed to it, nor did they know that these waste piles were radioactive. And you can see how closely the villages are located to these waste piles. And it's not something that is in the past. It's something that continues today. The Kanak peoples in Brazil, this is representatives of the tribe that are watching the river after the Fundão tailings dam broke in 2015. They had relied on the river as a source of food, as a source of water, and found that now they are switching to processed foods that have really impacted their general health in terms of development of chronic disease. They have a lawsuit that is still pending today against 3 of the big mining companies that were responsible for that. And about 20% of the Amazon basin is indigenous land that's impacted by mining, either legal or illegal, and projected to continue. When we move to clean energy, we find we still have continuation of pretty much the same picture. So these pie charts represent and by the way, as I go through, references are available on these in the red. I'm not necessarily going to mention all of them, but they are there. So if we look at these pie charts for where the rare metals and other metals that are used in the energy transition are coming from, the yellow indicates indigenous owned land, and the green peasant land, blue both, purple neither. And what you can see is that indigenous lands are still pretty much at risk from the clean energy economy as well. I found this tremendously interesting. This is the proportion for the reserves for these metals and what the ownership of the land that these metals are located under is. And what you can see is 85% of the world's lithium is located on indigenous lands. And you see a pretty high percentage of most of these metals. So this is an impact that is definitely going to be continuing into the future. If we look at the uranium story alone, this, the red squares in this top graph show the cumulative total of uranium that's been pulled out of various countries in up to 2022, excuse me. And then this is future projections for land, for uranium resources that are accessible at prices less than $130 per ton. And for a long time, when nuclear power was not moving forward in the US, the price of uranium stayed at around $11 a ton, and that was not making it economically feasible to bring out of the ground, so the industry was fairly flat. A lot of the mines closed. There was a spike when the industry started marketing and pushing for expansion of nuclear energy. That kind of fell apart. The market fell down again, but now in the last 10 or 15 years, what we see is a pretty steady uptick, and we're now up to about $62 a ton, and that's starting to become economically feasible again. And it's not hard now in the press to come across articles that promote that this is not only a possible alternative, this is a necessary alternative. And it is also not hard. This is an article from USA Today that was printed this week. And underneath we have an article that was printed a month ago talking from an indigenous perspective about the damage that these mines in the Athabasca Basin in Canada are doing to indigenous lands. And part of the issue when people are talking about the safety of these is that it's a pretty standard decision process that we see in most decisions politically made. There's not a full cost accounting that goes into it. There's not cradle to grave calculations. Things are created without any plan of what you do with them in the long term or the impacts to the people that are most closely affected. In COP26, Indigenous people pushed for, quote, free, prior, and informed consent on decisions as climate change solutions move forward, and made particular note of the fact that fast tracking is cutting corners in protection of the environment and culture. And basically they were asking for being part of the discussions and being part of the solutions. There is a UN Declaration on the Rights of Indigenous Peoples that has the unfortunate acronym called UNDRIP, which is really hard to say with a straight face. It's interesting that that is the only global declaration that deals with Indigenous rights on a global scale. The US, Australia, and Canada, all three of which are very heavy mining industry-based economies and heavy involved in the global mining market, especially with uranium. None of them signed on to UNDRIP when it was put forward by the UN in 2007. In 2010, the Obama administration noted that they support UNDRIP, but that their interpretation of it was that you would have to talk with Indigenous leaders, but it didn't require any agreement or consensus on how to move forward. So I'm going to shift gears again and talk about some of the work that we do with Navajo Nation. We use art a lot in our translation. This is work by Mallory Kataki, who's a Zuni artist and an artist in residence. She started as an artist in residence in our program and now leads our translation. And what you see in this is that the Superfund Center is very broad-based, and it looks at both environment, exposure pathways, health, intervention, and these are all community-partnered studies. These are the communities that we work with, 3 of which are Navajo, the 4th of which is Laguna Pueblo. Navajo Nation has more than 500 abandoned uranium mines spread throughout Navajo Nation in clusters, so there are also non-affected lands. And Laguna Pueblo is home to the largest open pit mine for a time in the world, and always for the US. So those are our primary partners. We look at a broad range of pathways that we'll be talking about as we move forward. With the Navajo birth cohort study, though, we now have the chance to look at multi-generational impacts, which is a real opportunity. This will be the first time that we've had that opportunity. So we have developed the basic research designs that are underpinning all of the work that I'm going to talk about from the original study that started in 2000 at the request of 20 chapters in the Eastern Agency of Navajo Nation. So Navajo Nation has about 110 chapters. Eastern Agency, when this work started, had the highest rates of chronic kidney disease in the country in the earliest onset. It was not uncommon to be sitting in a room and see a teenager with dialysis port. And at that time, they were extreme relative to the rest of the country. I think the rest of the country's kind of caught up in the intervening years, but at the time, they really were far ahead, if you want to call being very sick ahead. And they were very concerned that drinking uranium-contaminated water that was unregulated water that they had access to was possibly contributing to this. So the study was designed to address that question and has remained the basis. It's a very iterative model that involves the community at all steps and allows for reevaluation of where we are at the end of each study to reframe together on how we move forward. From the science side, we make sure that we start with surveys, but then we go back and back that up with lab studies to try and unravel the physiological basis for any effects that we see, to validate by looking at clinical records, and to reproduce what we think is a mechanism by doing clean exposures with animal models. So if we look at toxicity and health from that original study, the question again was, is drinking this water causing our high rate of chronic kidney disease? And what we found was that the community, the participants who had been exposed during the era of active mining, when we would have expected the exposures to be a lot higher, there was a lot more uranium moving around, and probably they could still have been chronic, but they may have been shorter term as people moved in and out of mining communities. This study did not include workers. Most of the workers had died by the time we started this study. And what we found was that those exposures did indeed increase the risk for chronic kidney disease. And this was on top of all of the other risk factors. They all came out significant as well as contributing to kidney disease. But the environmental factor was as or more important than they were. If we move, though, to the community exposures that are still ongoing today, to these legacy wastes, as we talked about in the Redwater Pond community and the Northeast Church Rock mine waste, what we see is an increased risk for hypertension and for having multiple chronic diseases when we look at a group of diabetes, chronic kidney disease, and cardiovascular disease. And much to our surprise, we also saw a much higher likelihood of producing autoantibodies and having frank autoimmune disease. We went back to the lab with serum samples. We had about 1,300 people in the survey phase of that study, and about 350 of them moved forward into a biospecimen collection phase, provided sera and urine for laboratory analysis. If we could incubate that serum with explants of primary coronary epithelial tissue, what we saw was the factors that were circulating in the serum relative to exposure increased the production of cytokines that had been associated with development of atherosclerosis. So again, this is confirmation of what we saw as hypertension as a primary effect of these exposures. And a few years later, Katie Zykowski, that was work from Molly Harmon. Katie went back and took mine waste dust and exposed mice to it, and then looked at the responsiveness of the vascular system. And what she saw was you got an increased contraction to a serotonin stimulus and a decreased relaxation to an acetylcholine stimulus. And you could reproduce those same effects by doing direct exposures to vanadium or uranium. So we think we have a very clear picture of what we learned from the community being indeed a primary outcome of the exposures to the waste in these communities. If we look at immune dysfunction, which came up in the survey phase of the study, we've been able now to look at the pattern of autoantibodies that are produced and to show that it's very similar to the kind of pattern that you see with a drug-induced lupus, so consistent with an environmental exposure as opposed to a naturally occurring phenomenon or a genetically based phenomenon. We've also seen that in the serum we could see evidence of pro-inflammatory cytokines that were associated with, if we cluster, we have a lot of metals that are in this waste. It's usually not just pure uranium or pure vanadium, but a mixture, which makes it even harder from a scientific side to figure out what's going on. But if we look at the clusters that fall out, if you try and parse out from the biomonitoring of exposure what metals people were exposed to, the highest clusters tend to be associated with the production of pro-inflammatory cytokines. So again, more response, more validation for that immune dysfunction hypothesis. And then if we go back and do bench studies looking at primary thymus cells and exposing them to uranium, what we see is an increase in retained DNA damage, and we also see inhibition of primary spleen cells T-dependent antibody responses. We've also seen urine in uranium of pregnant moms, and what we find is that the circulating cytokines tend to balance more on the inflammatory side during that pregnancy, and the children that are born at birth, if we look in those children, we also see more evidence for higher uranium exposure and higher pro-inflammatory cytokines, and that kind of response has also been associated with neurodevelopmental delays, and we'll come back to that later on. So this situation with immune dysfunction was something that actually the clinicians from IHS had brought to our attention when we started these studies, and they were very concerned because they were having to treat any kind of infection with much higher doses, much longer duration antibiotic treatment. They could see the difference in response when people presented in the university, for example, where those protocols were not followed, that the infections did not resolve well. They looked to see if it was because people were coming for treatment late. That was not underscoring the results they were finding, and they were very concerned about it. And that was caused us to start looking at the immune system in the first that had never been associated with these uranium exposures previously. one of the big confusions within my team with the immunotoxicologists was that uranium is not really well absorbed from the gut. And so if it's not getting into the circulation and not circulating systemically, why was it having central immune disruption? And finally, one of them, Scott Burchell, who unfortunately died very recently, said, hey, if it's not being absorbed, that means that the cells lining the gut, the lower gut, which we know are part of an immune central control axis, are getting massive exposures from all of that material that doesn't get absorbed. And they started doing studies looking at the gut and finding that you could see disruption of the microbiome, you could see disruption of the epithelial immune axis and some markers, biomarkers that we could follow through on that. And then Julie In, who has developed a novel colloid model where she develops these organelles from normal, healthy, resected tissue, human tissue, has started doing exposures to mine dust. And what she sees is a very substantial increase in the epithelial differentiation of cells. And she is doing studies now to try and figure out exactly what that looks like and functionally what the significance of that is. But we think this really starts to address a long-term argument that has been used to frame regulations that if it's not absorbed, it can't be having a toxic effect. So I'm going to switch gears now and look at environment and what we've learned about what this material looks like. This material started being deposited over 80 years ago now, and the last mine closed over 35 years ago. And so it's been sitting out in the desert sun for years and exposed to lots of weathering processes. And the community wants to know, when we see clouds like this coming over, what is in those clouds and what do these things look like? And our team has gone back, the mineralogists have gone back and looked and found that indeed this material has degraded into nanoparticulates. The mineralogy of those nanoparticulates varies by site, just as the deposition of various metals in the ore would have varied. But they're very small. They're the little white dots here. This is a respirable particle of clay. So this is something that can readily be inhaled, and it's carrying the toxic minerals from the mine waste along with it. We have much less understanding of what that toxic like or what that distribution is going to look like. Our geographers have used their GIS skills to go back in and look at multi-criteria modeling so we can start looking at where is this stuff sitting now. Navajo Nation is about the size of West Virginia, and so if you think about these very fine particles being wafted in the wind and moved around, there's going to be a lot of things controlling where they move to. We're working with Navajo EPA to try and make some solid predictions. Again, that lack of infrastructure in indigenous communities is holding this process back because there are no MET stations. There is no EPA monitoring network within that we can rely on to get the inputs for these models. We do have a way of validating. There have been flyovers to look at where the remaining radioactive resources are, and so we can look at the model predictions and validate against that NURI database. It's not at a scale that we need to be at, though, and we've found that if we can start adding MET stations in key areas, we can really start bringing the uncertainty in that model down. So we're deploying probably 3 or 4 more MET stations in the next few months, and hopefully we'll have that model in better shape. The other community concerns that you saw in that first image of Mallory's on the conceptual model were around the safety of agricultural land use. These are land-based populations that rely heavily on agricultural production for food, both of sometimes as high as 90 to 95% of the diet is coming off of the land. And they also were worried about cattle. The cattle are not only part of their diet, the cattle, the sheep and the goats, the livestock are also an economic resource in that they do market them to surrounding communities. And we've been working with communities to try and understand that process a little better. And Ileana El-Hayek has done some really lovely work where she's looked at how the concentration of calcium in the rhizosphere controls how those metals move from the soil, from the water, into plant roots, and then depending on the calcium, as the calcium concentration increases, the material moves from the roots to the shoots and becomes an even stronger pathway then back into the livestock. We've also been looking at how fungal communities in the rhizosphere control that uptake, how they interact with those metals, and looking at whether we can use what we've learned about both the fungi and the calcium to develop bioreactors that might be available to put in a community level purification system before using those waters for agricultural use. And to try and get a better handle on what some of these exposures are, we've also collared livestock with one of our communities, actually now with 3 of our communities, and monitored where they graze and where they get their water from and how much time they spend there, and then gone back in to the areas that are most heavily used and looked at what the concentrations of these metals are in the water sources and in the plant material. This is an area with very steep canyons. All of the yellow spots are abandoned uranium mines that are draining down into the watershed. The green represents the area that the livestock are using for grazing, and this area is a water hole that they spent a substantial amount of time at. So we're analyzing tissue concentrations now to validate and develop models that we can use in a more predictive manner. And so talking about intervention, which has always kind of been our goal, and certainly the communities, one of the first things they told us is, we're not stupid. We know we have a problem. We want to know what we can do about it. And so being academics, we had to go back in and verify there was a problem living this close to an abandoned uranium waste pile, and then figure out what we might offer as a solution. So several people on our team are molecular toxicologists who had been working for a long time on zinc finger control of regulatory proteins. And what they found was that arsenic was very good at outcompeting the zinc, but not as good as putting that protein into the right form to be active. And so with arsenic exposure, you actually inhibited a lot of those regulatory proteins, including regulatory proteins that repaired DNA, that regulated enzymes that repair DNA, and also regulated some of the immune cell functions. And the other thing they found was that this was not a really tight coupling and that you could outcompete that binding with just normal dietary sufficiency of zinc. And so we knew that this worked in the lab, we knew it worked on the bench, we knew it worked in animal models, we didn't know if it would work in people, but it's a pretty low-key intervention. And the other thing that we found in talking literally for years to the communities was this was something that resonated well with the culture, because this concept of holistic balance and looking at the fact that uranium didn't belong on the surface, uranium belonged in the earth and had been removed, and now you were using a natural element to restore the balance of that system. And so we worked for probably a solid year, going to the communities, talking about zinc, looking at how the diets had lost zinc inputs, and talking about how this kind of clinical trial would be structured so that people would be interested in participating in it. So the design in the end was jointly developed by the community and our team. They developed the brochure. Mallory developed the artwork showing that we had this perfect storm where you have a radioactive element that breaks double-stranded DNA. You have metals that disrupt the repair of that. You add zinc, and it's like stringing beads back together and putting the protective symbols back on the cell. So we have preliminary results at this point, and we've already learned a lot from the study. We've only got data from about 19 people. We have 40 people now who have actually completed. COVID happened right as we started this, so it's been a little bit of a rocky road, but we've already learned a lot of really important information. And one of the things we've learned is that these exposures are very episodic and they're very flexible. So if we look at these three metals, uranium, vanadium, and arsenic, and these are now individual participants in the different colors at the 4 sampling times. Sampling goes on over a year, 2 samples collected before the zinc intervention, 2 after. And what you can see is that if you try and compare for the same person at different time points, you see the metals going up and down. So these are not uniform chronic exposures that are happening at a stable base across time, which leads us to new ways of designing lab studies and bench studies to be able to try and mimic this a little better. The other thing that we found is the exposures are substantially higher than we originally predicted. If we look at the NHANES data set, which is the national monitoring of all of these metals that CDC does, what we see is that 37% of the participants in the in the Thinking Zinc clinical trial exceeded the 95th percentile for NHANES. And we would have expected that to be 5%, so a 7-fold increase in the number of people who were exposed. If we looked at our birth cohort data and we looked at the parents who are much younger, they're about 28 average, we saw about a 4-fold increase over that, about 20%, sometimes 30% of the men more likely than the women who were exposed. So this has taught us a lot about how we think about how these exposures happen. We've also been seeing positive impacts in terms of increasing the clearance of uranium. Uranium stays in the bone for a very long period of time. With the zinc treatment, it starts coming out. That was something we hadn't thought about initially, and we're happy to see. We've also seen reduction in the oxidative stress, the oxidative DNA damage, which we had shown was related to exposures in this population previously. But I also wanted to include some photos so you can see where we're doing the clinical trials. This is the road on the way to one of our communities and the sign to the community. During COVID, we were not allowed to be on the reservation at all. It was completely closed to anyone outside, and people on the res couldn't come out. So when we were first allowed back in, it was outside only, so we were collecting samples masked and in tents outside with childcare available for community members. The community's been very involved in these studies, and it's actually the first time I've ever been involved with a clinical trial where I can walk into a meeting like this and somebody will spontaneously stand up and essentially take over the lecture and tell people how they need to be part of this, because this is such an important thing for the community. So I'm going to switch gears now to our birth cohort study. It started independently through a congressional mandate. It is now part of the National Environmental Influences on Child Outcomes, along with about 30 other sites in the country. So we have a total of 55,000 kids. This basically took the place of the National Children's Study. And this allows us to look not only within Navajo, which we learn a tremendous amount from, but also to look across other populations to see if these effects of the metals are the same, if some of the socioeconomic indicators are driving some of what we see, or how those things are interacting. During COVID, we also learned that we needed to develop our own independent way of collecting samples, doing assessments. We now have 3 of these mobile vans that we use so that we don't end up in that situation again for whatever reason. We have the front half of this is actually a room with a separate outside entrance that we can do neurodevelopmental assessments. We do about a 4-hour battery of tests with several clinicians and community staff involved, as well as parents. So this has really improved our ability to make sure that we can stay in contact. And I mentioned that we have a range of exposures. The blue and green dots here are where our participants are. We have, over the whole course of the study now, somewhere around 1,000 in our cohort. The red X's are the areas where the mine waste is. And so we have people who are in areas that have very low probability of exposure and others who are very proximal to the mines. And I don't know if you're familiar looking at bean plots. There's something that isn't used very much, but our communities actually like them because you can see with these little purple lines going across where actual people are. The width of the purple lines indicates how many people fall at that point on the curve. If you're used to looking at curves, just think about turning it on its side and looking at one half of it. But what we do is we're referencing now here to the NHANES 95th and 50th percentiles. The green lines are central tendency measures. And what you can see is that we have much higher than 5% above the 95th, as I mentioned. These are moms at enrollment and delivery. What we did not expect is that we had babies who were born with urine uranium concentrations that exceeded the 95th percentile of adults in the US population. We have a significant number who exceed the 50th percentile, and these literally are first pee from baby. And the other thing we didn't expect, that by the time these kids are 4 years old, they look very much like their parents. And that's true for uranium. It's also true for arsenic, which also increases. And arsenic is co-located with uranium at almost all of these sites. And the interesting thing about arsenic is it doesn't look like we have terribly high exposures to arsenic until you start parsing out what form of arsenic it is. And virtually all of our arsenic is inorganic, the more toxic form, whereas in the US population, when we're comparing, there's a lot of organic arsenic that comes through diet or through eating fish, which is not a big part of the Navajo diet. If we go back and look at those clusters again, we have the two highest clusters here that are pretty high in virtually all of the metals that you see along the x-axis. The good news for us, and the thing that we like to ensure the community of, is that about 20% of the people in the study have no evidence of exposure to any metals at all. And so that's a little bit of good news, because you walk around telling people that they're all exposed, and it makes everybody nervous. And we also have other clusters where there's different patterns of exposure, but they're still relatively low. If we go to these higher quartiles for a lot of the metals, though, what you see is a 3- to 4-fold greater risk of preterm birth in the women in those clusters. And I know you're all looking at this bright orange line in the middle and saying, well, why isn't she talking about that one? And I just want to use that to highlight that when we look at mixtures, we never know what we're going to find. This column is mercury. And as you add more mercury to the mix, it tends to counteract the toxicity of the other metals. And we're not the only ones who have found that. And these are, I just want to emphasize, very low levels of mercury. We have so few detects on mercury that we can only break it into tertiles. We can't even get quartiles for it. So interesting and surprising outcome for us. If we look at the comparative sociodemographic indicators, this is a comparison. We did a particular breakout study from the ECHO cohort using our cohort against the most well-heeled cohort that we have, and that's in Champaign-Urbana. And what you see is if we look at the income bracket of less than 20,000, that's 55% of our cohort. If we look at iKids, 71% of them are bringing in more than 70,000 for family income. If we look at education, we see our cohort with 27% below high school, and we see the Champaign-Urbana at 100% with a bachelor's degree or higher. And then looking at employment, we also have a pretty major difference between the cohorts. So we know that we have a cohort that is on the marginal end of the socioeconomic scale. We also know that that can impact diet. We've looked at a lot of micronutrients. What you see in the red square at the bottom here is I'm sorry, I had my cursor on the wrong screen. I don't think you've been seeing it. But if we look there, what you see in that red square, this is now not compared to NHANES. This is compared to the World Health Sufficiency level for zinc. And what you see is that we have a substantial number of the population, both moms, dads, and babies, that are zinc insufficient. So relative to the basis for the clinical trial, this is a concern for us. If we look at the full spread of micronutrients, we see that The last study that was done on nutrition during pregnancy on Navajo was in 1981. And when we looked based on diet, we saw exactly the same profile. There were very few changes, very few improvements. We see zinc at about 33% of where it should be for pregnant women. Iodine is at about 50% of where the sufficiency for pregnant women should be. And both of these were of concern because both of these micronutrients are important in normal organogenesis and in normal neurodevelopment. When we start looking, we see very substantial and significant delays in verbal development, especially in little boys by the age of 4. Those are starting to become apparent during the first year of life. We're now going back and doing follow-ups at age 8. But if we start looking at not only the metals exposure and how that contributes, we know that various metals are significant predictors of some of the verbal delays that we see. But then we start looking also at these other things like the micronutrient deficiencies and the socioeconomic deficits. And if we look at these in a random forest model to look at the relative importance of variables, we see that the toxicity is way swamped by the sociodemographic factors, by the family income and the employment status of the mom. But we do see that both the serum zinc and the urine iodine levels are also significant predictors, as are some of the other metals. And if we look at the patterns, I think this is a nice illustration of why we care where the doses and the mixtures are in these exposures, because you can see on these BKMR models that serum zinc and iodine clearly have a positive effect. The higher they go, the higher the performance goes. Urine, uranium, and strontium, pretty standard negative effect on verbal performance. But for some of these other metals like arsenic, you have more of a U-shaped curve, or barium, and depending on what kind of dose people had, what it was mixed with, we could have very different outcomes. So I want to sort of close by just a really brief overview of what happened during COVID. So we now have a population that we're pretty intimately involved with that is all of a sudden impacted literally overnight. We had a team in the field actually doing assessments, and we started getting calls from community people saying that, oh my God, something's happening, the hospitals are closing down, the doors are locked, people are walking around with heavy protective gear and oxygen tanks on their backs, and we had no idea what was going on. So our staff are distributed throughout Navajo Nation. They're embedded in the hospitals, and they became a really nice in-between that we could use to help distribute supplies to, because there were no medical supplies, no protective gear that was available during the pandemic, especially in the early years. We were able to pull together a team of pilots from Los Alamos who loved flying out there with supplies every 2 weeks. We had distilleries in town that were making sanitizer, and we would take out whole pallets of sanitizer and distribute it. We had liquor distributors who were carrying materials out as well. We had seamstresses and just community members on Navajo that we would get material to, and they would sew gowns. We had mountain supply companies that were making masks that we were also delivering thousands of. But one of the things I really want to call attention to is the artwork that our staff realized that the messaging, the informational support that was going out was completely antithetical to the culture. And in Indigenous communities, they've survived a lot of trauma and a lot of stress historically, and that's all happened because they pull together in times of crisis. And it was not at all believable that you would get through this by isolating. And so Mallory and other artists got together and did a lot of artwork to try and convey this in a way that was a little more palatable and that might have a better chance of getting through. And in addition to that, you know, concepts like wash your hands off and when you don't have running water are not something that you can really work with very well. The other thing that we found out was people were being discharged and told to go home and isolate. And the problem was there are no grocery stores at home to be able to get supplies. And so they were coming out of hospitals in Gallup, for example, a reservation border town, and the first thing they would do, the whole family would go into Walmart or Smith's and buy food. And so that was an exposure pathway that it actually took surprisingly long. When you're kind of inundated with that number of people that are coming through the door, it did take longer than it should have to realize that was happening. We started, and others started providing food packages that the hospitals could then give people to take home with them. We did a lot of work with tribal council, trying to predict how different things that they were doing or different things that outside communities were doing were impacting the spread and the transmission on Navajo and the projection. We looked at comparisons with surrounding states, and then we also worked with a lot of people in a group called the WACG that was put together by IHS sanitarians to try and figure out how they could distribute clean water supplies, and our staff were instrumental in helping both stage that delivery and in making people aware that those supplies were available. We also, right at the beginning, with cohorts in ECHO, moved to try and oversample in some of the hardest hit cohorts the populations that they were representing, so that when this was over, we would have enough data to be able to go back and do comparisons to try and figure out how that situation could have been handled better. And what you see here, the cohorts that we worked with, there was an urban Black cohort, the Navajo cohort, another Indigenous cohort from South Dakota, and a South Dakota white rural cohort. And what you saw was indeed the Indigenous cohorts had the highest prevalence in adults. They were very similar, but if you looked at the kids, Navajo had the highest impact on children. And this is something that we want to keep following through. And we're continuing to see how this evolves and what some of the long-term impacts on that would be. If we look at some of the hardships that were endured in the communities, some of the support systems that they relied on, some of the outcomes, the stress outcomes, and how these things interplay to produce stress, and then long-term being able to look at how that stress impacted parenting. And then also looking at discrimination, because Black Lives Matter started right in the middle of the pandemic. And that impact, that discrimination and racism was clear not only in the Black community, but also in Indigenous communities. The actions of the federal government to Indigenous tribes reinforced that. There was a health board from the Northwest Coast that asked for support and supplies, and they were sent body bags. People on Navajo would go in to try and get supplies in gas stations and wouldn't be served. White people coming through would be served. And so, you know, we wanted to see how that played out across these communities on top of the fact that there were all of these other stressors, and if what kind of a long-term impact that might have and how it interplayed with some of these other factors. This is a graphic showing the relative degree of economic, home life, and emotional health hardship that was endured by the four communities. Navajo had the highest economic hardship by a long shot. They also had the